our flag. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for that. The next order of business is the presentation and approval of the minutes, which are in our packets. Has everyone had a chance to review them? I'll entertain a motion to approve the minutes as presented.
So moved.
Thank you. Is there a second?
Second.
Any additions, corrections, deletions? Hearing none, all in favor of approving the minutes as presented, say aye.
Aye.
Any contraries? No, the minutes are approved as presented unanimously. Our student intern from Radnor High School is apparently not here with us yet this evening. I haven't heard anything about her absence. Oh, here she is. Welcome, Ms. Lee. Ms. Lee, we have only so far approved the minutes that you've drafted for us from the last meeting, so you can record that as a unanimous vote to approve the minutes as presented. So you can take up your chores from that point. Thank you. As far as announcements are concerned, Dr. Humphrey, David Humphrey, a member of the board, indicated that he is unable to, due to a work conflict, to be with us this evening. I have not heard anything about Dr. Leader. I don't know if Mr. Taltone, did you receive any email from her?
I have not.
Okay, thank you. So hopefully she will be merely late. That indicated, I want to move on to the health officer's report. Mr. Taltone.
Thank you, Mr. Chairman. Good afternoon. I guess the first thing I'd like to report is on my challenge to lose weight. I was not as happy as I thought I'd be. I did lose 3.5 pounds, but I'm going to continue this fight. I guess that's the first thing. Under announcement, what you find is Mr. Chairman, Mr. President wanted to highlight health awareness issues that we look at each month, and Ms. Kelly Doyle was helpful enough to provide us with a list of things. And you'll find in your packet a list for November. American Diabetes Month, Diabetic Eye Disease Month, Food Health Issues Related to Diabetes Awareness Month, Lung Cancer Awareness Month, National Caregivers Month, National Healthy Skin Month, and I don't want to mess this word up, Gastroesophageal Reflux Awareness Week, which is the week of November the 20th to 26th, 2011.
While we're on that subject, I know, Ms. Doyle, that you did some research in coming up with the calendar of health observances, and there are certainly more of them than we can probably recognize at every meeting. I have a concern, though, as to its accuracy, because that calendar indicated that the Great American Smokeout was November 18th, when actually the website of the American Cancer Society and other websites indicate that it was November 17th, last Thursday. And it's usually always on a Thursday, so I don't know what the confusion is there.
A reputable website. I'll check it and get back to you.
Thank you. Yeah, I just want to be sure that we've got the right dates for these events. And the Great American Smokeout, of course, is an effort. I think they're in their 36th year or something like that. and it's usually on a Thursday in November, and this year was November 17th, last week. And as the name of it would indicate, it's a national effort to get people pointed down the path of quitting smoking. Okay, thank you. Mr. Taltone, please.
Thank you, sir. During the month of November, as health officer, we inspected 13 rental inspections. These are new rental inspections for quality of life issues, 5 bathing places, 23 food inspections. We have several new ones, and we have a lot of people interested in coming in Radnor, opening up food facilities here. One at Panisse Cafe at 100 Matchaford Road, Building 1. Panera Bread is a new one that just opened up at 219 East Lancaster. Valley Forge Flowers in 503 West Lancaster Avenue. We call it Spread Eagle Village. Paramore Restaurant, that's in the Wayne Hotel. And we also have coming that should open within the next 30 days. So Fun Yogurt, which is in the same strip mall where the Panera Bread and Anthony's Coal Fire is going to be in there. Ella's American Bistro is going to be on 212 Sugartown Road. Mediterranean Grill, which is on the corner of Conestoga and West Wayne. Five Guys Burgers and Fries is going to be in that same strip mall where the Acme was. And Jules Thin Crust Pizza at 114 East Lancaster, where your gourmet kitchen formerly was located. We dealt with 10 quality of life issues. 3 of those issues were animal related, 5 were property maintenance, 1 was a food facility complaint, and 1 was a zoning violation complaint. Under informational items in your packet, you'll find a couple of things from Mainline Kids Healthy Living Program, which I think is a pretty good articles that they put out. One is on the impact of obesity and academic performance. The other was on the impact of obesity on cancer. You got a communication from the League of Women Voters inviting Board of Health members to a luncheon on December the 6th. I forwarded that to you by electronic mail and hard copy. You got communication from the Tobacco Use Prevention and Control from National Association of the Local Boards of Health. Also in your packet, you'd find Delaware County Hazardous Waste. They have a collection scheduled for 2012. We'll be revisiting that again. I'm giving you more updated information that's coming up. For the summer, we give you, in your packet, you'll find a summary for the Take Back initiative that took place in April and again last month, which was a program that was able to get prescription drugs that were outdated, that type of thing, out of households and properly dispose of it. This last program, I have the numbers in here somewhere. They were able to take in 40.38 pounds this past month. In the April collection, they were able to take 89.5. That's a total for the year of close to 130 pounds of prescription drugs that will not get into places that they shouldn't be. So I think the police and those law enforcement officers did a great job with that. We also have on the agenda for tonight a hearing to petition this board to home quarantine a cat that received a wound of unknown origin. And that person is here tonight in the name of Miss Stephanie Carroll. So ends my report.
Thank you for that report, Mr. Taltone. Any questions, comments, or otherwise about the report? I'd like to add another announcement with great pleasure. I do hope this is going to be an ongoing thing. We have with us today an official representative of the Radnor Township School District, Mr. Kevin Kane. Mr. Kane, I'd like you to say a few words about yourself and what you envision or hope to accomplish as a result of this collaboration here. Thank you.
All right, thank you, Mr. Chairman. Yes, my name is Kevin Kane. I'm the Director of Student Services and Special Education at Radnor Township School District. I started there in July, a few months back. Prior to that, I worked 7 years in a similar position at Neshaminy School District in Bucks County. What I'm hoping to get from this collaboration is really an opportunity to facilitate communication between both entities, the Board of Health and the school district, to leverage both of our resources for the betterment of our students in our care. A little bit about the school district. We have over 3,600 students in 5 schools. We have 9 nurses that work in our schools. They also support our non-public schools within our boundaries. So we work with a lot of students. So I'm hopeful that the relationship that we have and continue to have will impact positively those students. Thank you.
Thank you. And again, I really sincerely welcome this collaboration, and I look forward to interacting with you on a number of children's health issues. At this point, I'm going to be skipping to another item on the agenda under new business. We have with us Mr. Ed Klein, who is the Delaware County Volunteer Management Coordinator, and that's, I gather, a new posting. And he has come here tonight to provide us with some information as to what he is going to be doing in Delaware County, and for Delaware County. Mr. Klein, why don't you step forward to the podium and welcome.
Thank you very much, Mr. Hassan. Good evening, everybody. My name is Ed Klein. I am the Volunteer Management Coordinator for the County of Delaware Department of Emergency Services. I began this new position on September 6th, just a couple months ago. My role is that I have the responsibility to create a county-wide disaster volunteer system, which will include the County Animal Response Team, County Emergency Response Team, or CERT, and of course the Emergency Medical Corps, or as some know it as the MRC. I come from an emergency services background. I have 24 years of experience in the fire service in Delaware County, 15 years full-time experience as a police officer with the Borough of Swarthmore. I currently continue to serve as a full-time police officer, and I also volunteer as the fire chief of the South Media Fire Company in Wallingford, Delaware County. The Medical Reserve Corps is a branch of Citizen Corps and offers medical and non-medical professional volunteer opportunities to build community education and response. Each county in the southeastern Pennsylvania region has an MRC branch. We operate together to perform various functions and training, both local and regional. In fact, we just all returned from a FEMA Region 3 training in Washington, D.C., which was held at the Federal Department of Health and Human Services. So there's good connection there between the local level and the federal level. And they really want us to push the directives from the Surgeon General through the MRC and out to communities like yours. In the Medical Reserve Corps, we are building volunteers that'll have access to cutting-edge training and exercises to help build and educate and prepare our region. The MRC volunteers are not seen as first responders, but as a resource to the National Incident Command System. Delaware County MRC is the backbone of our volunteer program. We know that our citizens will be able to mitigate against, prepare for, respond to, and recover from a disaster. Our volunteers come from hospitals, doctors' offices, schools, businesses, and even the neighbor next door. Some have a medical background and some do not. It is the county's responsibility to ensure that our volunteers have the knowledge, skills, and abilities to perform assigned tasks under real-world conditions at the onset of a disaster or during the recovery period. Conducting training and performing exercises is how we will spend most of our time in this preparation. It's also extremely important that we grow our ranks and expand the public perception of the MRC. This is something I start today, meeting with you. I plan to meet with many of the townships and boroughs within the county, the school districts, and of course our first responder fields and nursing and hospital staff and doctors' offices alike to gain volunteers through our MRC. We need for between 50 and 100 people per pod, point of dispensing, through the SNS program in the county. If you use a factor of 1/3 of the people that will actually show up during that emergency, we need thousands of volunteers in the MRC to support that program. Some counties like Montgomery County are looking to place 6,000 volunteers into their MRC in order to ensure that they have 2,000 people to run their pods. I wouldn't suspect that we would be much different than that, even though we have not set those goals at this time. In 2012, Delaware County plans to schedule MRC orientation classes, progressive training, local and regional exercises during each quarter of the year. As I prepare this training schedule, it'll be pushed out to all the volunteers within the MRC program and all the disaster volunteers within the all-hazard sections of Delaware County that I'm also responsible for. Anyone who wishes to join the MRC can do so by going to the Serve PA website, which is the volunteer website in the state of Pennsylvania, at serv.pa.gov. Once you develop a profile on Serve PA, that'll be accepted by me, and you'll get information about upcoming events and training. Obviously, if anyone has any questions about the MRC and needs further information, they can contact me at the Department of Emergency Services at 610-565-8700. And of course, I'd like to thank you for the time that you've given me tonight. I've brought brochures for everyone here with my business card, so if you give me just a moment, I'll hand them over to you.
While we're passing that out, are there any questions for Mr. Klein?
Where are the trainings conducted? Are they all conducted at one place, or do you go to different places around the county?
We'll be using several locations around the county. In fact, I'm looking to develop partnerships with some municipalities and first responder agencies to conduct those trainings. We'd like to try to keep it local so that it's convenient for our MRC volunteers, our disaster volunteers. For everyone, we will be conducting an orientation training at the Garnet Valley School District next week for all their bus drivers who have volunteered to be part of the MRC. We will be conducting a orientation training at the 911 Center in January. That date has yet to be set because of some other trainings, especially with the SNS program. But we will be involved in every level of SNS pod training throughout the county as the MRC. And we will be involved in our own training. We'll be involved with Southeastern Pennsylvania regional training locations, and many of their trainings are held at the Montgomery County Fire Academy because of its ease access to all 5 counties. And of course, we will have a lot of our local events as well. The biggest part of getting our name out will be getting involved in local wellness fairs, health fairs. Obtaining that information ahead of time so that I can schedule a group to be at these type of events, to push the needs of the MRC and obviously the objectives of the federal objectives at the Surgeon General's level is very important. So I want to be able to obtain that information from the local municipalities as soon as it's available.
Other than the sort of orientation to how the system works, what are the specific kinds of training you would ideally like to give volunteers?
Volunteers, first and foremost, need to receive the orientation training so they know what's going on, of course. Right behind that, they need to know how to be prepared in a disaster for themselves and their families. So personal and family emergency preparedness is key, or else they won't be able to volunteer when we need them most. After that, they need some pod training. They need to know how the Strategic National Stockpile Program works and how they're going to be deployed throughout that program. They also need to know how to operate in a disaster format, how we're going to credential them, how we're going to ask them to operate and communicate during the disaster, what kind of points of dispensing are going to be, where their points of contact or rally points will be. Getting into specifics, we've had members of our MRC do suspicious articles or bomb type awareness, rescue awareness type training, communications training with the Aries and racist groups. It's been exciting to be involved in some of these different levels, and through the region we get a lot of specialty training that you may not get through other ways. Our biggest challenge in training is obtaining classes with continuing education credits. As we all know, the nurses are required, and I suppose the doctors too, yet people haven't complained about that too much to me, about getting credits for these classes to maintain their licenses. And something the region's looking at heavily is finding ways we can get CEU classes into MRC programs. It's a big pull for volunteer hours and to keep them excited about our program.
With the hospitals in the area too, a lot of the hospitals have emergency preparedness committees. Does the MRC coordinate with them as well?
Yes, the MRC will be coordinating with all 6 hospitals in Delaware County. Crozier Keystone, in fact, has been a very big supporter of the program already. There has been a little bit of miscommunication about how the MRC would be used in a true disaster. Some healthcare facilities fear that if I'm going to take all their volunteers to go do something, what are they going to do when they need those extra shifts of people to come in? And that's not the MRC's purpose, to take away from any healthcare facility or from their planning stages. This is a way to train volunteers so they get to know one another, so that they understand what the real world situations will be if we have a pandemic event or some other kind of natural or man-made disaster. This is a way that they can shake hands, break some bread, have some fun, learn something new, and be there as a group in totality, whether it's the hospitals that need more people, whether it's the SNS program that needs more people, or we simply need to get together and support shelter operations like from the Red Cross. Some of these areas are just blank. How do we operate a medical shelter today in Delaware County? That's a tough situation, and the MRC is what's going to solve these problems.
So you're anticipating recruiting about 6,000 volunteers, if I heard you correctly?
Well, I gave
That's what
that
Montgomery
number as
County-
an example from Montgomery County.
Right.
Thousands of volunteers will be needed to be able to meet the objectives of the MRC that would be put to us should one of these events happen.
So what is the strategy going to be for recruiting that number of people?
The strategy will be to partnership with as many medical facilities and healthcare entities that we can to get the word out about the MRC, to spread that among not only the healthcare area but also the education side of the healthcare area, to spread that into our colleges and schools, and to develop training that keep people motivated to volunteer throughout the whole until we have an event where we need them.
Would you mind repeating that website for people
Yes,
who may...
www.serve, S-E-R-V, how come I keep breaking that? www.serv.pa.gov, serve PA.
And that's the site for people who wish to learn more information or volunteer?
Right, that's the site that you would sign up through in order to volunteer with the Medical Reserve Corps. You can look up Medical Reserve Corps, spelled out that way, and it'll bring you to the federal site for the Medical Reserve Corps. I've been very impressed by the interaction at the different levels of government. Coming from an emergency services background, you don't usually see federal, county, and local people sitting at the same room talking about how to solve a problem. And we did that for 2 days in Washington, D.C., and I was very impressed of the interaction between someone that's in charge of a whole division at the Department of Health and Human Services federally, right there talking with local coordinators like myself in order to make sure that not only are we learning the best practices for how to recruit volunteers, but that we report what we do, which is very important when trying to maintain grant funding. You need to be able to say what you do, and the more we do, the better chances we have to maintain this program which is entirely federally funded.
I just want to second what you said, that it's not just, medical people, that people of every different kind of background, are encouraged to volunteer.
Yes, the nurses that would hand out the pills, we hope, of course, instead of the shots at an S&S program, can't do any of that if there isn't somebody in the parking lot, if there isn't somebody holding somebody's hand, if there aren't people to set it up and break it down, to do the paperwork, to identify who's been there and who's not. And all of that takes a horrendous amount of time to operate. And the more we see how to be prepared, the more we know that it's the citizens themselves which will make or break the event. We cannot do any of this if citizens aren't prepared for disaster. And if the MRC is a way for someone to learn something on how to act when a disaster happens, then we really have done a great thing for them. And they will in turn do a great thing for us.
Any further?
Yeah.
Certainly, please.
What sort of disasters are you talking about?
Mr. Klein, would you repeat the question because she's not on a mic?
That's quite all
I
right.
won't-
She asked what kind of disasters am I talking about. The Strategic National Stockpile is designed to provide medications to the public should they be needed for some sort of pandemic event, an H1N1 type event where large masses of people would need some sort of medication to respond to that incident.
And that didn't really happen, and it wasn't even safe. So how would you know that what you're giving would be safe to give?
These are good questions. And this kind of information, you can go to different websites that are out there for that, like vaccine.com or .gov, and find out more information about what's in the federal caches of medication that's available to the public should a pandemic event occur. What we're talking about is how to obtain the volunteers necessary to support that type of event. The medication itself is something that someone else deals with besides myself, so I couldn't answer questions specifically relating to the types of medication or how that's even decided what medication that would be.
Because I would have thought in a pandemic, it's best to keep people quarantined, not all go to the same area. And
Those are questions that that's a good question. Her question was, why would people be asked to go to one place instead of being quarantined? And I think we're getting outside of my purview, which is creating volunteers to support a program. But it sounds that question would be something that would have to be decided at the onset of that incident, if a quarantine is something that needs to be done, or if a mass dispensing needs to occur. This program is designed to take care of mass dispensing, the
would it be
S&S program.
mandatory, or would there be choice involved in that?
Again, you're getting back to, she's asking, would it be a mandatory type event? And my response would be that, again, that's back to a decision that is made at least the county, state, or even federal level on how to make a response to a particular incident.
I just wanted to make a few comments. First of all, I want to thank Ed Klein for coming out today. We also have CERT teams in the township. The police department run training on community emergency response team members. Also, at our last Board of Commissioners meeting, we appointed Sergeant George Smith as the emergency services coordinator for the township. During Hurricane Irene, we did something quite different here than we had done in the past. We actually set up an emergency response center here in this room with multiple tables and multiple phones and computers, and we essentially, because this building has a generator, we were able to coordinate not only services within the township but external services as well. So we had members of the police, the Public Works Department, and other members of the township working here along with volunteers. I believe that also extended out to working with the utility companies, communicating with the utility companies, and also with American Red Cross as well. So I would hope Sergeant George Smith is our contact. I'm sure he'll be in contact with you. I'll make sure that he gets your information.
Great.
Because I think we already have somewhat of a network in the township, and if that CERT network were to work in conjunction with the county, it would make a lot of sense, you know, because it's kind of duplication of effort, yet all in the same goal. So,
Yeah, in fact, the CERT program, County Citizen Emergency Response Teams, does come under my responsibilities. And for the first time this past month, the county has agreed to make CERT a shared entity among all the municipalities in Delaware County and the county itself, which gives me the leeway to run more training, to do more of that cooperation and coordination and collaboration, to ensure that not only does your CERT team get the support it needs from the county, but that your CERT team becomes part of a larger response group when they're needed to serve during a disaster. So, I mean, that's a great thing. I have taught some emergency preparedness training here through the county before, and I know that we've communicated with the police department a couple times already, so it'll be good for everyone to have that collaboration.
thank you.
Now, Mr. Fisher, is the township administration in this program that you've just been talking about working with the school district, or does Mr. Klein work directly with the school district? How is that going to work out from his perspective?
I'm not sure, Larry Taltone may want to speak on this, because Larry had just conducted a lunch and learn on residential awareness of the, on pods, and that's somewhat related to this discussion. So maybe, Larry, you want to comment on that?
Yeah, I believe Dan Malloy, when he was emergency management coordinator, was working with the school district with Leo Burnaby and his staff on a plan. In fact, I attended 1 or 2 meetings. I am also certified through FEMA and NIMS. I have 15 certifications. And as part of the township's workplace safety committee, we do what we call lunch and learns. And last week, for example, I conducted a class on residential emergency management, emergency awareness, and what you do if you're shelter in place, what you do if you have to evacuate. And also, as a part of that training, I showed a film on a pod, how one operates. It was conducted by the Philadelphia Health Department. Yeah, we're pretty aware of it, and we look forward to working with you.
That's wonderful. One other opportunity that may interest the school district, not obviously the SNS program that I know they've been involved with before, but the CERT team, we ran a teen CERT at Strathaven High School last year, and it was very well received. And that's something that I can do as well, as create a program if you want to do something like that in your schools. I really believe that we can teach all of these evening programs and weekend classes and really be successful in providing emergency preparedness training. But we're still going to be talking to the minority of people. The only way for us to talk to the majority of the people is to get into our high schools and provide them with personal emergency preparedness. We've seen decades ago how the fire service was able to rally around smoke detectors and learn not to burn and 2 ways out. And now that's almost every kindergartner, first and second grader in the county gets that program somehow from someone. But we're not teaching shelter in place or how to evacuate or even what channel to listen to when there is a major disaster or event, and how to get that information. And that's something that we all have to do in order to make sure it's in people's minds when it happens. It's very hard to motivate people in the northeastern quadrant of the United States to be prepared for a disaster. We just don't get enough hurricanes, tornadoes, or earthquakes, even though sometimes we get them within days of each other. So, but again, I thank you for your time tonight.
Well, Mr. Kane from the school district has your card and the little brochure you gave us, so I don't know if he has one to give you, but I would invite you to set up some kind of contact with him, because that's important on all the points you raised this evening. Thank you very much for
Thank you for your time again.
Thank you. Okay. We'll now move on to old business. The first item is teen health issues, and it gives me a great pleasure to indicate that the video that was prepared or actually done last last spring, is available now on the township's website, and I don't have dates as to when it is actually aired on the township's cable channel. Mr. Doling is not here this evening. But probably a better way of accessing that virtually on demand is by getting to the township's website. Mr. Taltone, will you remind us what that is? Remind us of what the township's website is for citizens who want to look at that video.
Yes, it's www.radnor.com, www.radnor.com.
Thank you. And I want to, at this point, thank our last year's student intern from the Radnor Township School District, Allison Mosier Mills, for her work in putting that together at the high school with interviews of students. I want to thank Amy Leader for her leadership in seeing that happened, and Ms. Wishner, Amy Wishner, for her interview of Dr. Offit, which is a part of that video. And I would invite everyone to take a few minutes and look at it and learn what some of the issues are. Okay. The Alliance for Safe Kids, or ASK, as I reported at a previous meeting, is working on a program on cyberbullying. The Alliance for Safe Kids is an organization composed of school district administrators, other persons. One of the township commissioners, Elaine Schaefer, is a member of that group. I'm representing this Board of Health on that organization, and there are parents as well represented on that organization. The meeting has been scheduled for that program. It's December 7th at 7 p.m. It's scheduled to last an hour and a half. And the presentation will be an hour, with 30 minutes being allowed for questions. It will be at the Radnor High School auditorium. And again, that's December 7th at 7 p.m. I understand that the main presenter will be an assistant district attorney from Delaware County, who has done lots of these presentations countywide in the past. So we're looking forward to getting a lot of good information about an issue that seems to be affecting more and more of our kids. Radnor Reach, I know, had a meeting last week, which none of us was able to attend. We got rather short notice of the meeting. I don't know, Amy, if you've had an opportunity to contact anybody, find out what they did.
They're still supposed to be sending out notes from the meeting.
Okay, as soon as those are available, we'll get some information on that and what any next programs are going to be. The Environmental Advisory Council, Ms. Kelly Doyle represents this board on that council.
I was unable to attend that first meeting due to, it was a little notice for me to change my schedule, but I have confirmed that I'll be at the next meeting, which is this upcoming, not tomorrow, next Tuesday at 6 o'clock. So I will bring anything back here to this board.
Thank you. I want to get to an item of old business that is not on the agenda. We've talked about our contacts with, or principally my contacts with Dr. George Avedian, who is the Delaware County Senior Medical Advisor. And Dr. Avedian, if you'll recall, was here last spring and gave us a presentation on what he envisioned his role was going to be, and he's been going around the county, meeting with lots of people in that regard, meeting with people at the Pennsylvania Health Department and other activities of that nature. He emailed me, Dr. Vedian did recently. He has met recently with two persons from the Pennsylvania Lyme Disease Awareness Committee. The names are Doug Fern, who is chairman of the Lyme Disease Association of Southeastern Pennsylvania, and Don Hannum, board of directors of the Chester, Delaware County Farm Bureau. Those two gentlemen are interested in arranging an educational symposium here in Radnor, hopefully, on Lyme disease. And I indicated to Dr. Vedian that based on our previous attention to this issue, that we would welcome the opportunity to work with these gentlemen in supporting and helping to actually realize this symposium. They have not, as of this evening, gotten back to me. Dr. Vedian emailed me on November 17th about this program. So I did get back to him, and again encouraged him to have Messrs. Fern and Hannum get in touch with me, and I will keep this board apprised of any future developments along those lines. I believe this is an important issue. Staying with Dr. Avedian's activities, he has offered to come back. We haven't scheduled a date, and address this board and this community regarding his proposed, or not so much proposed anymore, but he has worked out a time frame, a chronology for implementing the recommendations of the Johns Hopkins study. And I've asked him to come back to us and apprise us of what that time frame is and what the milestones in his future activities will be, and of course, as always, how we can work with him to help him realize that daunting agenda. So as soon as I have a date from Dr. Avedian when he can come back and address us on what the future is going to look like in terms of his activities, we'll schedule that. Any questions on Dr. Avedian's activities? Hearing none, let's move on to new business. We have a hearing to home quarantine a cat whose name is Coco, and I'll ask Mr. Taltone to lead us into that.
Thank you, Mr. President. On November the 14th, I got a call from a local veterinarian informing me that we had a resident who had a cat that was brought in that suffered a wound of unknown origin. In addition to that, the cat was not current with its rabies shots. Under our ordinance, Chapter 115, Animal Ordinance, Section 6, it requires that if that animal is not current with its rabies shots when it has that injury, that there's three options. The first option is to put the cat down. The second option is to quarantine it at a local veterinary hospital for 6 months. Or the third option is to have that cat quarantined and until such time as they can petition this board for permission to home quarantine. In that process, I was able to contact the owner of the cat, Ms. Stephanie Carroll, directed her to take the cat immediately to a local veterinary hospital and keep it there until such time as she requested in writing permission to quarantine. She did so. And in an effort to expedite time, I went out and visited the property. There was a couple of issues that I had a bit of a problem with, and I wanted corrections made. I went back on Friday, they were done. One of those issues was that she has 4 additional cats, and I wanted to make sure that those 4 additional cats were current with their rabies shots. I do have documentation that they are current. One I had a bit of a question with, So I consulted with Dr. Donato to get some clarification, and so we're fine with those, and he can speak for himself on that issue. I went back and inspected the house. The house, he is, in my opinion, capable of or has the facilities to be able to quarantine him at home, and that decision is up to the board.
Do you have a recommendation, however?
I think she can do it, yes.
Dr. Donato, before we put that to a vote.
I wanted to ask if the Coco, the cat, will be quarantined on its own or will be exposed to the other kitties.
You have to respond to him.
That's
Can you
horrible.
come forward to the microphone, please, and identify yourself? Thank you.
I'm Stephanie Carroll. Coco is my cat. Obviously, I guess. So what is, she'll be in a room by herself. She won't be exposed to the other cats.
Okay, great,
Okay.
thanks.
Any other questions of Ms. Carroll? Okay,
I just had one of Dr. Donato. So how effective is the rabies vaccine? In other words, if vaccinated animals are exposed to a rabid, a rabid cat, do we regard their vaccination status as proof of their immunity?
Well, according to the state of Pennsylvania, there's still a quarantine, even if they've been exposed, because nothing is 100%. And unfortunately, with the severity of this disease and its effect on humans, even if it's a small percent, nobody wants to take that particular risk. So is it effective? It is a very effective vaccine, but I don't know anybody who's wanted to take that risk.
I'm just wondering if there's been already exposure to the other cats, do they need to be?
It sounds like
quarantined as
Coco's
well?
been kept at a veterinary hospital away from the other cats since the bite wound was
Yes,
discovered.
That's where she is now.
But was there a time after the bite where Coco was home and with the other cats? That's my question.
Yes.
Oh, so that leads to, that's a good point. Did Coco bite any of the other cats?
No.
Well, okay, while at home.
Mr. Chairman, can I ask a question?
please.
How much time passed between the time that Coco was injured and the time you took Coco to the vet?
A few days, less than a week.
And so during that time, Coco didn't bite the other cats in the household, or any people for that matter?
No, she's very
Good.
docile, whatever.
Sure.
She's not
Is-
aggressive.
Yeah, isn't it a bite or scratch because of the, it's saliva, right? So they could lick as they do, clean their claws and then.
Sure, yeah. I mean, it's, again, typically through bite, but did she scratch anybody or any of the other animals?
No.
I think it's important that I do mention this. I talked to the animal control officer today before the hearing, and he tells me that there is a couple of colonies of feral cats in that area.
Sure.
So I just wanted to bring that point up.
And certainly, we don't know what caused that injury. So we always just have to assume that it's a rabid animal, because when it comes to people's lives, we always would rather take those precautions.
Oh, certainly, I
Yeah.
can understand that.
Yeah.
Certainly.
Are the other cats outdoor or indoor cats? Do they go outside?
They're outside,
They go
inside. Mhm.
And you felt comfortable that you felt everything was in order for a proper quarantine?
I think she has the capability of quarantining it safely.
I would propose a motion that Coco can be quarantined at home, following the regulations and also the routine visits that Mr. Taltone can perform.
Yeah, I went through the requirements every point, and I made it very clear that if I come to visit the cat, if it is approved, and I find out that Coco is not under strict quarantine rules, he will go back. Be euthanized.
Dr. Donato has moved to allow the home quarantining of Coco in accordance with state regulations, subject to Mr. Taltone's periodic visits. Is there a second? Ms. Wishner has seconded. Any further comments? What is, under the state regulations, just one question that I have, what is the duration of this home quarantine?
It's 6 months.
6 months. I just want to make sure Ms. Carroll knows that. You're
Yes,
aware
I'm
of that.
Thank you.
Okay, we'll put it to a vote then. All in favor, say aye.
Aye.
Any contraries? Okay, the home quarantine is approved. Thank you. Ms.
Thank you.
Carroll.
And Dr. Donato, you don't feel anything else is warranted in regard to the other cats, like that they,
As long as they're not exposed to Coco, I think it's fine. Generally, again, these quarantines require that they're in one room without any exposure to any other animals. Usually there's one caretaker, and if that's the case, then there should not be an issue. And that's the good part about having Mr. Taltone go out and take a look is does he feel that can happen? And I think we're in agreement that that can.
I think it's more a question of, do you feel like the other cats are at risk of having acquired rabies and then they're out, they're outside?
Yeah, I don't, obviously not having examined each one, but typically in these cases, there's, unless there's a bite wound, there's not any major concern. While scratches can happen, we'll see that those pop up, I hate to say, soon because they always get infected. So, again, if the other cats appear healthy and do not have any wounds, we should be in excellent shape.
What should Ms. Carroll do if she sees any infection sites on the other cats?
Yeah, you have to head to your local veterinarian to get them looked at and assessed what those wounds may actually be, and then address those properly. If they are found to be, a bite or a scratch, again, that goes back to we don't know where that bite or scratch came from, so there would be a quarantine period for that cat as well. It's not as long when they're outdated on their vaccinations, but there still is a quarantine period.
Any other questions or comments? Okay, we'll move on then. Is there any other, one other item of new business. I asked Mr. Taltone to distribute to each of you a grid showing your initial date of appointment, whether it's the first term or second term, and the final term ending date. I just ask each of you to review that and make sure it's correct, and if you have any questions about it, please get back to Mr. Taltone and let him know. Thank you. Are there any other items of new business? Okay, we'll move on to the last item on our agenda is public comment. There are some people here from the public who, please step up to the microphone and identify yourselves. And
Hello, I'm Talia Palant. I'm a resident of Radnor Township, and this is Suzanne Stapler and Angela Walker. We're here because we're concerned about what the township is spraying on the Radnor Trail. We believe it is a health concern. They're spraying Roundup all along the trail, and we would like to know if you are aware of that and your position on that.
I am not personally aware. I don't know if Mr. Taltone knows anything, or Mr. Fisher, the Township Commissioner. Mr. John Fisher is President of the Board of Commissioners of Radnor Township.
Well, first, thanks for coming out to share your concerns. I'm not aware of the township doing any spraying. However, in the past 2 years, PICO has been doing applications of Roundup along the corridor, the rail bed, where they have a utility easement for their power lines. Apparently they had done this down in my ward, the 7th Ward as well, along the Route 100 trolley line. It's something we're going to look at. I'll ask the Director of Public Works to look into this as well and find out if there was an application done.
We know for sure that there was. Yeah, we know that there was.
Right. Okay, well, I guess what I will do is I'll contact the Director of Public Works, Steve Norsini, and the Director of Parks and Recreation, Tammy Cohen, to find out if they were responsible for any application of Roundup. But again, I venture to say that if it's in that, the Radnor Trail is a rails to trail type trail system. I would bet that there's a utility easement along that trail, and there's a good chance that that application was done by a utility company. But we'll find out who did that, and then if you can leave your contact information, I'll have make sure that staff gets back in touch with you, let you know. If it is the township doing applications of Roundup, we're certainly going to look at that, because I mean, I would find it very hard to believe, because generally the township has a stance of organic compounds only. So for instance, all of our parks in the township are treated with only organic fertilizers. We don't use pesticides. We don't use herbicides in general. So certainly look into that for you. And could you just give me this is on the Radnor Trail?
Yes.
Is it in between the whole trail or just one part? Or?
It's all the rock beds, the mulched areas, and the gravel along the trail.
Okay. All right, I'll look into that, and we'll have someone contact you.
Okay.
But
We
please,
actually have
before
a-
you leave your information with me.
Absolutely.
Mr. Fisher, I mean, there are probably other concerned citizens. If you're going to get back to these three, but how will the other people in our township learn the outcome of your investigation?
Well, I can, I'll have, actually, the township staff will get back to you with information.
We did got about 110 signatures, because
Okay.
we were talking to
Well,
people about it.
whatever the findings are, I'll be glad to bring this back to the Board of Health, and we'll enter that into the minutes here. But it may also get announced at the Board of Commissioners meeting as well.
I actually talked to a gentleman.
Oh, please go up to the microphone for the folks at home.
I actually talked to a gentleman in Parks and Recreation. I don't have his name with me, but he confirmed that they do spray it, and he was, I would say, pretty closed-minded, saying that it was completely safe and that's what they do and that's it.
Okay.
So.
Well, that might be something we have to look at. If that is the case, if that is the truth, then if there is a lot of support in the township to not use things like inorganic compounds like Roundup, then we can certainly look at that from a policy standpoint, and then maybe from this point on we don't use such chemicals. It's definitely something of interest to me. And
But yeah, we have loads of organic consumers association about the health effects, cancer-causing effects of Roundup. There's masses out there on it.
okay, I appreciate, yeah, and please share that, you can share that with me.
I had a quick question. Did you see, like they had a sign that said it was Roundup? Is that it?
Yes,
Oh, okay.
actually,
All right. I just wanted to
yes.
make sure.
Yeah.
Okay.
So it was posted?
Yes.
Yeah,
Yeah.
okay. Well, that's, you know, there are a lot of, the township has, you know, the Board of Commissioners sets policy, but we don't set operating procedures for departments and for the staff. But something like this kind of what's the right word? They kind of cross into a policy decision. So we may have to make a policy decision as a township whether or not we're going to use pesticides and herbicides on any of our public land. So it's something we certainly, again, I'll be sharing it with staff, but at some point it probably should go to the EAC as well, and Parks and Rec, because they maintain, are responsible for most of the public land that we have.
Right. Because I had contacted them a couple years ago regarding if they sprayed, and they said no, absolutely not. We're a green township, and this gentleman that I spoke with confirmed that they've been spraying all these years, but yet this is the first year they're actually putting flags up.
Well, okay, we'll have to find out what compound we're using. I know on the Board of Commissioners approves the expenditure for the fertilizers and treatments for our fields, and all of the contracts that I've voted on in the last 4 years were for organic compounds only. We were using no synthetic pesticides or herbicides. So I'm hoping that's the case, and maybe this, I'm hoping it wasn't, well, I don't really want to make a statement as to whether or not Roundup is safe or not safe. I don't know, but if there's enough interest by the public in the township to not use such compounds, then maybe as a board, the Board Health, the EAC, and the Board of Commissioners could all make a decision of what, you know, what the policy will be moving forward.
Right, okay. Thank you.
Thank you.
Just ask Ms. Doyle, since she is going to be attending, representing the Board of Health at the very next EAC meeting, that's the Environmental Advisory Council, to bring this issue to them, make known that there are concerned citizens, and that this is an issue that we and they and the Township Commissioners will be looking at.
I will definitely bring that up in the next EAC meeting. It's next Tuesday, November 29th, at 6 p.m.
Is there any other public comment? Hearing none, this meeting is adjourned, but let me announce that our next meeting is scheduled for Monday, December 19th at 5:00 p.m. in this room. If there is anybody who knows at this point or within the next couple of weeks that you will not be available for the next meeting, please let me know right away. So if we do not have a quorum, we will have to postpone the December meeting. Thank you.